Everyone. So as I introduced earlier, my name is Mandira from Volunteer Action Camden. So we're doing introduction to social prescribing this morning. We are community links from Volunteer Action Camden. We are part of Camden Care Navigation and Social Prescribing Service. So to give you the overview of the service, we are a single access point for the service, Camden Care Navigation and Social Prescribing Service. We work in partnership with Age UK Camden, Reese Plus, and North Central London Integrated Care Board. And we work closely with care navigators and link workers team who support with long-term conditions or complex medical needs. So who is like community links? What do we do? So as I mentioned earlier, we are a single point of contact. We terrace the service with different bodies, clinical, non-clinical residents, community, volunteer services in Camden. We connect referrals with various services, activities to improve health and well-being of residents, which can be benefits, home improvement, social engagement, finance, travel assistance, or getting a blue badge, and many more. So this is an approach that connects people to activities, groups, and services in their communities that meets the practical, social, and emotional needs that affects their health and well-being. So we connecting with the residents, signposting and them to the other services to help their health and well-being, to improve their health and well-being. So we have a community links volunteer. They are also a part of the service. That's what I do. I'm a volunteer coordinator. So I recruit, I manage, I train them. And my colleague is Nasrin Leads and Referrals, but unfortunately, she couldn't be here today. So I'll covering her part of referral as well. So talking about the community links volunteers, what they do, their role is they deliver a session, they do a session in the GP waiting area or any other community setting. It's in like face-to-face interactions with residents, and they help residents connect with the community activity services like signposting to community support and health service informations. We had to change their role during the pandemic because they couldn't be in the face-to-face environment. So during that time, they supported the team and the residents, operating from home remotely, with chatting with them and linking people with the external volunteers support like NHS responders, Good Gym, and other volunteer organizations, and doing the follow-up calls. They are also supporting emotionally during that time. But now they are going back to the face-to-face setting in the GP waiting area and the community setting. And they also, because being in the GP surgery, they also support direct support for the link workers and the care navigators. They are based in the GP surgeries, so they work closely with them to improve the health and well-being of the patients in there. So for them, the volunteers, they do very good trainings because it's, face-to-face, so they must have a good conversation. So they do a good conversation training with the MEC. Maybe some of you have already heard of it. It's making every contact counts. And the safeguarding, we have Diane to deliver it. So it is important them to have a safeguarding trainings. And they also can access some of the NHS trainings like coaching for health and any of the trainings. So we try to provide any relevant training to develop their role. We do the DVS checks for them and regular support session for them. We invite people from the various organizations to come on the support sessions, so to build the knowledge and connect people with the right services. And we also provide one-to-one supervisions, because their feedback is very important for the service development as well, because they are out there in the community, in the GP surgery, connecting with residents. We also support them into finding employment, because we have a track record of volunteers going into employment and also in the health and care sectors, in NHS, in the bio, as a biochemistry, or as a receptionist, or as a care coordinator in some boroughs. They're called care coordinator, not the care navigators. So they've gone into the employment in care center. So we also support with that, like references, with all that. So yeah, that's the volunteers. But now we are going to do some case studies. This is prepared by my colleague who leads and referrals. So we'll do it as a group, the whole group. I'll go through some case studies. Maybe you can, put your ideas, like how we can support residents. We have 3 case studies. So all the name has been changed in the case studies. So case study from the Camden residents. This case study reflects the complex and varied needs of people in Camden. They highlight how health and well-being are shaped by social factors that covers like loneliness and isolations, financial or housing insecurities, long-term health conditions, language and cultural barriers, life transitions, or loss of purpose. So when you read the case study, considers like how we can support them beyond the clinical care. So what other person needs beyond clinical care? How could your support or other VCS services can support them? What kind of referral or signposting might make difference? So think about it when you are doing reading a case studies. So social prescribing isn't just a pathways partner, but so you are a key point of it, because you all work in the community. I think we'll go to the first case studies. I'll read out the case studies. I'll give you a few minutes to reflect it back and just shout out how we can support that the person, or you can put it in the chat as well. Then we can go through that together after a few minutes. So first case study is Janet, who is 86, lives alone in Camden with partial vision and memory difficulties. Since her partner passing, she feels deeply isolated. While she has extended family, meaningful engagement is rare. Her days revolves around medical appointments and essential errands. She's unsure how to access support that could help her feel more connected and engaged in her community. So I'll give you a few minutes, and after a few minutes, you can write it in your chat or shout out. We will go through these together. Is that okay? Is everyone okay? Okay, Diane. I think I can't view the chat. So
Okay, no
you
problem. I can
can
read that out to
maybe,
you.
yes.
So basically, what we have is we've got signposting, possible signposting to a local talking group, if you do that, befriending scheme at Age UK or possible local community a day centre service.
Mhm.
Um, we thought maybe if there was I thought maybe assisting with maybe going to her appointment. So if we had a service that could help her go with her to her appointments, maybe so she's not going to those appointments by herself. Um, Ramik said that supporting with other older people services run by different various community centres to connect and engage her with similar people, maybe who are going through similar age. So yeah, those local community centres, and peer support groups, possibly with Mind, our local community centres and groups. So yeah, things around that nature. Is that right?
Yeah, yeah, absolutely. And the support needs that we recognize um, is like absolutely like companionship, like you said, like befriending, with the AGK Camden, and accessible transport, like getting a blue badge, a taxi card, community engagement, absolutely, so, and the support for memory resources. So we referred her to the AGK Camden and to the K Navigators team to get a, blue badge taxi card, so it makes it much easier. And also like community engagement is very important. So we have referred her to the like activities in Castle Havens and the link because she has a long-term condition. So we have referred her to the K Navigation team. So absolutely, that all correct. Like, talking groups, peer support group, befriending, community engagement, absolutely. So,
And I take it,
you know,
Mandira, this is a true, real case study and very typical of
it
what the
is.
prescribing service would get.
Yes, this is a like true the case studies, but of course the name has been changed. So so yeah, this is we gave the support like companionship, accessible transport, community engagement, support for the memory issues is. And we engage with the AGT Camden, Castle Haven, Care Navigators team. Yes. So the next the case study we go to is a Sean, who is 25 and they just moved back with his parents in Camden due to long COVID symptom. With the background in finance, he has had to pause work. He has lost confidence, especially socially, and finds online groups overwhelming. He wants to meet others facing similar challenges and explore options for returning to meaningful work in the future. So I'll give you a few minutes. I'll keep a time. Okay, 2 minutes, and we'll come back to it.
So we have already got a few things coming through Mandira.
That's great.
A group that's possibly supporting men, young men. I know that there's even in a couple of weeks, I think that was in our VAC newsletter, there's a mental health in, I think it was Health Watch Camden. There's like a mental health, males, mental health groups, maybe. We thought maybe something around work and employment support. if you've got access to any of those kind of organisations. Refer him to some kind of, yeah, the report, it's what I was thinking, employment service, some kind of referral service. I've got IPS Hestia here. Georgia made a really good suggestion, maybe, which I should have thought of, volunteering, which is a really great, that's a really great way to sort of slowly get him back in. Men's Sheds Association, yeah, thanks for that, Anne. Yeah, so volunteering, anything that kind of puts him back in control,
Mhm.
but slowly. Um,
Yeah.
so
Yeah.
yeah,
Yeah.
at his
Great.
own.
No, the answers are, absolutely, that's correct. Like, see, he needs to engage, he wants to engage, but not online, more like in person. So the support that we recognize that needs is like, we have referred him to the like long COVID peer support group that we are aware of, that we can refer people who are suffering from long COVID. And of course, return to work plan. So we refer to the Job Hub Camden. And of course, confidence building. Like we have a Healthy Minds program, it's mine in Camden, so they do the Healthy Minds programs. And it's a face-to-face program. And also there is a program with the Castle Haven Community Center, the Health Haven. So we closely work with them and referred him to the Health Haven. So, absolutely, like, he needs that confidence because he finds the meeting with people online is overwhelming because he needs that in person. Maybe he lost that connect, with people, connecting with people. So we try to connect with like more like in-person socialized activities. So, and the peer support group, like people like, going through the similar, you know, conditions or, long-term conditions. So the long COVID peer support group is there, that run it. And, with the Job Hub, that also support him to going back to work also if he's willing to do the voluntary work. And we also help out people to connect to not only volunteer with us, but also to find the external volunteering opportunities. Like they are like Good Gym, Go now is a new link volunteer website, and VCC is there, and the other volunteer, the community, they're always looking for volunteers in their community as well. So we try to link with the right role for the people who are looking for. Okay, so the next and the last one, the case study, is Layla, who is 65, recently divorced, living alone, struggles with mobility and speaks limited English. Our first language is Farsi. She feels disconnected during the week, spending most of her time alone. Our flat is becoming harder to manage due to physical access issues, but she's not sure where to turn for help. So I'll give you a few minutes, just 1 to 2 minutes, and we'll go through it. Thank you.
This one actually, Mandira, is probably a little bit trickier. I mean, I know that I work with Camden Adult Community Learning, otherwise known as ACL, and I know they do ESOL and they do conversation classes. Georgia mentioned that it might be really great to refer her to Age UK Camden, because they've got a referral to their support services for mobility and transport, and they also do a befriending service. Again, Anne mentioned those ones. Great for sort of interaction and sort of reminiscing. So it's like a really joyful, sort of happier session, so that during the week she's sort of connecting, and that isolation part is not becoming a factor. Yeah, any other social, I'm not sure, any other social prescribing suggestions? Yeah, this one is tricky, because we've definitely got the mobility issues, but then there's also the English. So what did you do with this one, Mandira?
Um, uh, like as a team, because we recognize he has a language barrier, you're absolutely correct. Like, try to link up with the like ESOL classes, and adult community learning delivers ESOL classes in various, I think levels of and conversation as well in various community settings and in various areas as well. So it would be
Because I was
easier.
thinking at 65, she doesn't really want to go into the classroom, really, does she? She wants to do something a bit lighter, no? Right? Because she doesn't want to, but they do offer that, is what I'm saying. I was just wondering, because
Yeah,
some people.
they do offer it. It doesn't matter the age, because and the it is also maybe the time for her to socially engage with other people and also learn the language, and more confident in it. So language, giving the accessible to learn the language, that's important. And social connects, like maybe we referred her to give the information of the Henna Women's Asian Group. So, so maybe maybe she feels more confident in engaging with that setting. So, we referred her to the Henna Asian groups, and of course, accessible mobility assistance, like supported with to try to get the blue badge and taxi card. So, from the Age UK for the care navigation team, and also housing support, like we refer to our care navigation team. But I just want to clear that care navigators, they don't take the case, but they do the triage for the housing services to support with that, with the housing support. So yes, absolutely correct. Like she needs some social, activities to engage, also to learn the language, and also accessible, support. So we recognize these. And so ESOL Adult Social Care, HENA, the community, and the care navigation team from the Age UK Camden. But I just want to be clear out the one thing, maybe I missed it at the beginning, is like we work in partnership Age UK Camden, but it's not only for the people like over 55, but our service is for all the people who are over 18 can access it. Over 18 can access it, and we do get the referrals from clinical, non-clinical, or social care, and residents can can self-refer to us. So we have a NHS email and our general email as well. So thank you very much. I think you all did brilliant. And Diane, thanks for sharing their support. They recognize the support. That you all are absolutely correct. We have to identify what's our option out there in the wider community that our residents can access and improve their health and well-being. So that's it. So this is how to connect with us. So we have a free phone number 0800 193 6067. People can call that number, leave a message, and we'll get back to you as soon as we can. But there is our email as well for the general inquiries. If you have, you can email to us. And for the referrals, because of sensitive information, name, their background, their addresses, we have a social prescribing referrals, NHS referrals email. You can refer people that, but we have a form to fill it, referral form, if you want to refer anyone. You can go to our website, that's long website, click on that. You can know more about us and volunteers and our partners and our website, but also to remember that we are not an emergency service. So, we support the residents, we connect, support the services and, all that, but we are not emergency service, just to remember that.